Here's something nobody tells you about menopause. It's not just one thing. It's not just hot flashes or missed periods. It's your body rewriting its entire operating system while you're still trying to run all your regular programs. And somehow, we're all expected to just figure out on our own, armed with nothing but outdated advice from our mothers and a few cryptic symptoms that could mean literally anything. But here's the truth. Menopause doesn't have to be something you just survive. With the right information and tools, you can actually navigate this transition feeling empowered, informed, and maybe even a little bit excited about this new chapter. What's actually happening in your body? Let's start with the basics, because understanding what's going on makes everything less scary. Menopause is officially the point when you haven't had a period for 12 consecutive months. That's it. One day marks the finish line. But the years leading up to that point, that's perimenopause, and that's usually where things get interesting. During perimenopause, which can start anywhere from your late 30s to your early 50s, your ovaries are gradually producing less estrogen and progesterone. These aren't just reproductive hormones. They're involved in regulating everything from your body temperature to your mood, your sleep quality to your bone density. So, when their levels start fluctuating wildly before eventually declining, your whole system feels it. Think of it like a dimmer switch that someone keeps playing with. The lights aren't just going out gradually. They're flickering up and down, sometimes bright, sometimes dim, completely unpredictable. That's why your symptoms can be all over the place, and why you might feel totally fine one week and completely thrown off the next. The symptoms nobody warned you about. Sure, everyone knows about hot flashes. But did anyone mention the brain fog that makes you forget words mid-sentence? The weird tingling sensations in your hands and feet? The sudden anxiety that shows up out of nowhere? The joint pain that makes you feel like you aged 20 years overnight? Here are some of the most common symptoms that catch women off guard. The classics: hot flashes and night sweats, irregular periods, trouble sleeping, mood changes and irritability. The surprises: brain fog and memory issues, changes in skin texture and elasticity, joint and muscle aches, heart palpitations, changes in taste and smell, dry eyes and mouth, electric shock sensations, digestive changes. The thing is, not everyone gets all of these symptoms. Some women sail through with barely a hot flash, while others feel like they're experiencing every single one. And both experiences are completely normal. Why this transition matters for your long-term health. Here's where we need to get real for a minute. Menopause isn't just about managing uncomfortable symptoms. It's also a critical window for your long-term health. Those declining estrogen levels affect your cardiovascular health, bone density, cognitive function, and metabolic health. This isn't meant to scare you. It's meant to empower you. Because when you know what's at stake, you can take action. After menopause, your risk for heart disease increases significantly. Estrogen has a protective effect on your cardiovascular system, and when it declines, that protection goes with it. Your bones also lose density more rapidly without estrogen, increasing your risk for osteoporosis and fractures. But here's the hopeful part. This transition period is actually an opportunity. It's your body sending you a clear signal that now is the time to prioritize your health in new ways. The lifestyle changes you make during perimenopause and early menopause can have a profound impact on your quality of life for decades to come. What actually helps? Evidence-based strategies. Let's talk about what really works, because you deserve strategies backed by actual science, not just well-meaning advice from someone's cousin's friend. Hormone replacement therapy. HRT. This is often the most effective treatment for menopause symptoms, and recent research has shown it's safer than we once thought for many women, especially when started during perimenopause or early menopause. It's not right for everyone, but it's worth having an informed conversation with your healthcare provider about whether it might be right for you. Lifestyle modifications that actually matter. Exercise is non-negotiable, and not just for weight management. Weight-bearing exercise helps maintain bone density. Cardio protects your heart, and strength training helps combat the muscle loss that naturally occurs with aging. Even better, exercise has been shown to reduce the frequency and severity of hot flashes for many women. Sleep hygiene becomes critical. Keep your bedroom cool, establish a consistent bedtime routine, And consider layered bedding you can easily adjust. Many women find that limiting caffeine and alcohol, especially in the evening, makes a significant difference. Nutrition needs to evolve. Your metabolism changes during menopause, and what worked for your body at 30 might not work at 50. Focus on protein to maintain muscle mass, calcium and vitamin D for bone health, and plenty of fruits and vegetables for overall wellness. Many women find that reducing processed foods and sugar helps stabilize their mood and energy. Mind-body approaches. Cognitive behavioral therapy has been shown to be effective for managing hot flashes and the mood changes that can come with menopause. Mindfulness meditation can help with stress management and sleep. These aren't just feel-good practices, they're evidence-based interventions. Building your support system. Here's something that doesn't get talked about enough. Menopause can feel incredibly isolating. You're dealing with symptoms that affect every aspect of your life. And yet many women feel like they can't talk about it openly. Not at work, not with friends, sometimes not even with their partners. But you need support. Find your people. Whether that's an online community, a local menopause support group, or just a few friends who are going through the same thing, having people you can be honest with makes all the difference. And don't underestimate the importance of finding a healthcare provider who actually listens. If your doctor dismisses your symptoms or seems uninformed about menopause treatment options, it's okay to find someone else. You deserve care from someone who takes your experience seriously and stays current with the research. Reframing the narrative. For too long, menopause has been portrayed as the end of something, the end of youth, vitality, relevance. But what if we looked at it differently? Menopause is a transition, yes, but it's also a liberation. Many women report feeling more confident, more authentic, and more comfortable in their own skin after menopause. There's often a sense of freedom, from worrying about pregnancy, from caring quite so much about what others think, from the hormonal roller coaster of the menstrual cycle. This is your body evolving, not failing. And with the right support, information, and tools, you can move through this transition feeling strong, capable, and ready for everything that comes next. Moving forward, menopause isn't something that happens to you. It's something you can actively navigate. Stay informed, advocate for yourself, prioritize your health, and remember that you're not alone in this experience. Millions of women are going through this transition right alongside you, and together we're changing the conversation from silence and shame to openness and empowerment. Your symptoms are real. Your experience matters. And you deserve support, understanding, and evidence-based care every step of the way. This transition might be challenging, but you've handled challenging things before. And on the other side of this, there's a version of you waiting who's wiser, stronger, and more authentically herself than ever before.